Today I'm going to teach you all about the application of hot and cold compresses, as well as a little information on a few pain scale rating tips. So I'm first going to start with the effects of heat application. Generally, the effects of heat application are therapeutic as they work to improve blood flow to the injured part. It's important to remember that periodic removal and reapplication of local heat restores vasodilation. However, if applied for 1 hour or more, the body actually reduces blood flow. The effects of cold application initially diminish swelling and pain. It's important to remember that prolonged exposure of the skin to cold results in reflex vasodilation. The different times that you would use heat application are for things such as open wounds and muscle tension, where cold compresses would be applied to areas of direct trauma, such as sprains, fractures, or muscle spasms. It's important to remember that there are some safety suggestions that you have to follow as a nurse, as well as informing your patient. First, you need to explain to the patient that sensations can be felt, such as numbness, heat. Then you also have to talk about preventions. You also need to remember and instruct them that exposed skin is more sensitive to heat and cold. And along with that, you would want to teach them how to protect the skin while using hot and cold compresses. You would also want to provide a timer for application and check the patient's skin frequently to make sure there are no reverse effects of the hot and cold compresses. It's also important to remember that commercial hot and cold packs that you need to follow directions that are recommended for the heat time, and with the cold you need to observe for adverse reactions such as numbness or pain. I'm now going to talk about the different types of pain assessments. The purpose of using a pain scale is to identify pain intensity over time so the effectiveness of intervention can be reevaluated. The scale that I'm showing you now is called the Wong-Baker FACES Scale. This is used to assess pain in verbal children. The scale consists of 6 cartoon faces, 0 being no hurt, all the way to 5, which is hurts worst. And children as young as 3 years of age use this scale. 0 is described as no hurt. 1 hurts a little bit. 2 hurts a little more. 3 hurts even more. 4 hurts a whole lot. 5 hurts the worst. Here's a picture of all the faces together so you can see the comparison. When using this scale, you would point to each face using the words to describe the pain and ask the child to choose the face that best describes their own pain and record the appropriate behavior. The next scale we're going to look at is called the Numerical Rating Scale, also known as NRS. The NRS the NRS works best when assessing pain intensity before and after therapeutic intervention. It's important to select the scale that is appropriate for the patient's age, language, and ability to ensure the patient understands the use. With the NRS, you require the patient to rate the pain on a line scale of 0 to 10. 0 representing no pain and 10 representing worse pain. The most important part when using pain management is to ask about the pain, believe the patient, choose the pain control options appropriately, deliver interventions in a timely fashion, and empower the patient.